Cancer Holistic Guidance, Part 41. Dr. Dilip Gadgil, Pune. The patient I was talking about in the last segment, he stopped his treatment in 2004. He was doing all right for the next few years, but then he suffered some losses in his business in 2009 and started drinking alcohol. His health deteriorated rapidly and he was throwing up uncontrollably. He returned to Pune for treatment and I got him admitted to an Ayurvedic hospital here. I kept him on a strict milk-only diet and some medicines. He started responding to the treatment and recovered. He returned to Silvassa where he was living. 12 months later, the same thing happened yet again. He ultimately died in the year 2011. If you think about it, he lived for a good 18 years from 1993 to 2011 when the doctors had given him only 2 months. Another surprising thing was that his condition didn't change at all in all these years. His primary tumor was in the pancreatic head and there was metastasis in the liver. In these 18 years, there was no change in the tumor and he lived his life like any other normal person. It was just the last 1.5 years when he started facing problems. He used to drink 1.5 liters of milk every day and his food intake was adjusted according to his condition. When I tell people about this case, their first question is about what happened to his cancer. The fact that there was no change in the tumor makes people question how this kind of treatment could be called effective. I tell them, if you get 18 years of life instead of 15 days, doesn't that count as a victory? Is our objective to help the patient live well or to eliminate cancer, even if that means getting eliminated with it? This thinking is bizarre. The patient was told that he would live for 2 months if he opted for surgery and chemotherapy. His relative, who was an oncosurgeon, told him to not take the allopathy route and go for Ayurveda or homeopathy instead. Getting this kind of right guidance is priceless. He lived happily until 2009 without facing any challenges, although he shouldn't have discontinued the treatment and medicines in 2004. Even after that, he could have continued living well had he not suffered from stress and a drinking problem. In most cases, cancer relapses in the first 5 years, but in some cases, it may return 10 or 20 years later, too. He took to alcohol and it had its own ill effects on his health. It is imperative that we think about the effect of our own actions, too. Simply taking medicines and not caring about anything else won't help. People believe that medicines alone can take care of everything and hence, dietary habits don't have a role to play. However, this approach is wrong. If you control the diet, what is the need for medicines? And if you don't have to abstain, what is the use of medicines?